It's being called a caregiving emergency, and almost half of the 50 states are teetering on the edge of one. This is according to a study conducted by public health researchers at Columbia University, and they're attributing the emergency to insufficient numbers of home care workers and increasing care costs. According to the report, people in Alabama, Arkansas, Florida, Georgia, Louisiana, Nevada, South Carolina, and Tennessee are feeling the burden more intensely compared with folks in other states. And this is because worker shortages persist. And also, many of these states have populations in remote rural communities. Many of these locations are difficult for home-based care providers to access. And Aisha Adkins knows the struggles of caregiving all too well. The 40-year-old Georgian's journey, a labor of love, a story of sacrifice, after her mother was diagnosed with frontotemporal degeneration dementia. Aisha taking care of her for a decade before she ultimately passed in 2023. Aisha did not get much of a reprieve because her father was diagnosed with vascular dementia that very same year. Aisha is currently working to support her father now through his illness. And we do want to bring Aisha in now to talk more about her story. Aisha, really appreciate you shining a light on this. And, we were just talking about how much you've sacrificed in this journey, how intensive giving full-time care can be. I understand you didn't have a job, you didn't have health insurance while you were caring for your mom. What do you think most Americans don't understand about what's being called a caregiving emergency in this country?
Well, Natasha, thank you so much for having me. I think that some of the things that are misunderstood often about this care emergency is that um, there is very little assistance that is accessible to families who are in desperate need of help, whether it is because the systems themselves are designed in such a way that it is difficult to navigate applications for in-home care, et cetera, whether it's because funding is being cut or whether it is because there's simply just not enough people to keep up with the need within these states that you mentioned.
Yeah.
It is very difficult to maintain consistent quality care. There's high turnover, and it can be an exhausting feat, as well as a privilege, but certainly not without its
And
challenge.
I'm really struck by how you showed up for your parents, right? And you are not alone. And the amount of sacrifice over those 10 years with your mom, dementia and people who deal with things like Alzheimer's, it is such a cruel, such a experience filled with anguish, as you were showing up for that experience. She passes away, and then that very same year, your father is diagnosed with dementia. What was that experience like to get that diagnosis at that time?
Certainly. Well, my father, is in the very early stages of this disease. And um, while it was not surprising, he suffered numerous strokes. It certainly was frustrating and challenging knowing the road ahead, simply knowing that help would potentially be difficult to come by. I am at the same time grateful that I am able to rely on the experience that I had with my mother
Mm.
to inform the care that I give my father.
Yeah, and you were mentioning there's so much red tape, there is so little support. What advice would you give to the countless Americans who are in the exact same situation as you're in?
Yes, I would say do your research. There are resources that are available, but you do have to make yourself aware of the process. Make sure that you are tapping into whatever resources like the area of agency and aging may have available to you. Making sure that you are connecting to community so that you are not isolating yourself in an experience that can be very isolating, and making sure that you are taking care of yourself as best as possible as you encounter the many challenges that accompany caregiving experiences.
I really appreciate you coming on tonight and really want to acknowledge the incredible work that you have done. Aisha Adkins, thank you so much.
Thank you for having me.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.